Hello, my name's Professor Adam Winstock. I'm a consultant psychiatrist and addiction medicine specialist. I'm also founder of the Global Drug Survey. In this next section, I'm going to talk about what doctors do when they give you a physical examination because they're worried you're drinking too much. So the first thing doctors should do is ask you to kind of take off your clothes to your underwear, and they should probably weigh you. Weighing is really important. Increasingly in Western society, we are getting fat. And fat increases our risk of cancer and heart disease, premature death. And unfortunately, alcohol is a huge factor when it comes to obesity. There's so many calories in booze. It's dreadful, particularly because alcohol, a bit like weed, and many people don't know this, kind of gives you the munchies. Not only does it give you the munchies, once you're a bit pissed, let's face it, you don't really care what you eat, which is why so many late night fish and chip shops and doner kebab shops survive. Because people come out having drunk too much and they get really hungry. That's on top of all the calories you've consumed in a night out. If you want to really scare yourself, do the drinks meter and find out how many calories are in 10 beers. It's a lot. So, they weigh you. And what they should then do is see how tall you are. And once you get someone's height and their weight, you can give them something called a body mass index. Optimal body mass index is between 20 and 25. As you nudge above 25, which I'm familiar with, then you start getting into being a little bit unhealthy. Above 30 is obese, above 35 is morbidly obese. I think that's right. But either way, knowing how much you weigh is a really good starting point. The next thing that they might do is they might just look at you, which can feel a bit weird. But the reason they do that is that there are some things that heavy drinkers get that you can actually spot just by looking at people. It might be particular kind of busted blood vessels on their face, or kind of discoloration of their nose, which is called a rhinophyma. People can get also these little kind of split capillaries on their chest, which are called spider nevi and telangiectasia. And you can just kind of see from somebody's body shape, perhaps that they're getting muscle wasting, or that they're getting particularly obese around the mid-waist. And occasionally people can develop weird endocrine conditions, something called pseudo-Cushing syndrome, that can actually be spotted just really by looking at someone. What they also might do is ask to see you just walk. One of the reasons they might ask you to do that is that people who drink a lot of alcohol can damage the nerves, particularly in their feet, so people lose their sense of balance. The next thing they hopefully will do is get you to lie down on a couch. And at that point, doctors work through systems. So they'll take your pulse and they'll do your blood pressure. Why? Well, we understand what normal is, but we also know that people who drink too much tend to be at higher risk of elevated blood pressure. And also you can get abnormalities in your heart function, so your heart starts beating irregularly. What they'll also do is listen to your heart. They might feel where your heart is. And that's because people who drink too much can get something called a cardiomyopathy. You actually feel someone's heartbeat shifting to one side. They'll also listen to your lungs. Why do they do that? Because people with heart failure or people with liver failure sometimes get fluid collecting at the bottom of their lungs. But the other thing is that many people who drink too much also smoke. And so people who are heavy drinkers very often might have chronic obstructive airways disease, or might be at increased risk of getting chest infections, even things like TB if you come from homeless or migrant communities, or you come from a background where that disease is becoming increasingly prevalent. The other thing they will then start to do is hopefully look inside your mouth. They'll look at your tongue. You can sometimes get vitamin deficiencies associated with alcohol, and that means you can get changes in your tongue or your lips. People look at dentition. So very often people who drink too much have a pretty poor diet. And very often if people get constant regurgitation or reflux, that can actually cause pitting of the enamel in your teeth. Beyond that, they're going to start looking at your stomach and your organs, and they're going to start poking around. I mean, good doctors will start poking really gently because you don't want to touch something that hurts, because then patients get really upset. And what they're doing when they're kind of touching your stomach is they're seeing if there's areas of tenderness. Areas of tenderness might suggest maybe you've got a stomach ulcer, depending on where the tenderness is. But what they're also looking for is to see if they can feel your liver, particularly. You cannot feel a liver in a normal, healthy person. If you can feel a liver, that's not normal. and we know that alcohol is one of the leading causes of liver disease. In Europe, 1/3 of liver-related deaths are due to alcohol, for example. And the other things that they might be doing is looking at your skin, at your nails. They'll be looking at how much muscle you've got. So they might start tapping your arms and legs with that little tendon hammer, looking at reflexes. They might ask you whether or not you can feel a sharp prick or a soft touch with cotton wool. That's because sometimes excessive alcohol use can affect nerve conduction. They might also do some testing of what's known as your cranial nerves. That's where they kind of shine a light in your eye and they get you to follow your finger and see how strong you are. All of these things start building a picture of what the impact is of alcohol and, of course, other things on your health. If you're not actually sure why doctors are doing different things, I think it's worth asking. I mean, it's an interesting business, and actually being able to put all of that together and asking the doctor what they found, I think it's a really important thing. As I'm just about to finish this video, I know there are going to be doctors watching this who are saying, yeah, but you've missed this and this. Yeah, look, I put my hands up. I'm almost certainly missed something. But the bit I'm not going to forget, because that would be really daft, is that doctors should also assess your memory function. So alcohol is one of the leading causes of brain injury, either through trauma or just through heavy alcohol use affecting people's attention and concentration. It particularly affects in heavy drinkers the frontal part of your brain. So what a doctor also might ask you to do is they might ask whether you're orientated in time, person and place. Do you know who you are? Do you know who I am? Do you know where you are? Do you know what day of the week and month it is? They might give you an address or a set of numbers to remember and repeat back to them. They might do some stuff that's called verbal fluency, where they ask you to come up with a bunch of words that begin with the same letter. All of these things are tapping into particular parts of brain function that we know can be affected by alcohol, other drugs, and other health conditions. I mean, obviously this examination process is not specific to alcohol, but actually by conducting a thorough physical examination, it can start giving you a really good idea of what's going on in someone's health. In the next video, I'm going to go through and talk about what other investigations, such as blood tests, for example, doctors might then ask for you to get done once they've completed a physical examination.